You've heard the old saying, words have meaning, and so do acronyms. For example, there's PPO, HMO, and ADL. These letters can play a major role in healthcare decisions, but they only help if you know what they are. So ladies, let's take a closer look at some of those medical and caregiving acronyms.
OMG.
Right?
LOL. I mean, stop it already. Every industry,
Right.
every industry has these acronyms, but our industry, we impact lives.
Yes.
These acronyms aren't just like throwaway acronyms. You're talking to a healthcare professional in a hospital and they throw out DNR, past discharge, vitals, all, and the families just, they don't, one, they're trying to adjust that their family members in a hospital,
Right.
but then to adjust to the acronyms that industry. And then you go into the nursing home or the rehab center, they've got a whole nother list they want you to adjust to. ADLs. I mean, what the heck? ADLs.
ADLs, it's all activities of daily living. For a caregiver, I say it's all day long, it's something. And that's exactly what it is. But we use them because everybody talks in their own language. Every industry, everybody, a plumber talks in theirs. You know, everybody uses their own terminologies.
ADL is a really important one that I tell seniors, like, you need to know what this is because you are going to be judged by your ADLs as you age.
Sam, tell them what an ADL is.
It's
What does it
activities
mean?
of daily living.
Break it down.
Break it down. So it's what we're able to do ourselves and how independent we remain.
Bathing, dressing,
dressing,
eating, going to the
all
bathroom.
of those, yeah, all of the things that we take for granted as able-bodied adults, and then as our aging community, starts to lessen or become more limited, then we qualify their need based on their ability to do their own ADLs. And so, but we use in acronyms, we use SNF. So you're in a hospital and the nurse comes in and says, okay, we're going to discharge you to a SNF. Well, what's a sniff? Am I sniffling? What is
does
this?
that mean?
It's a skilled nursing facility, and we as care providers and in this field, we often take for granted that what we're saying. I can't tell you how many times I've taught and I've been teaching on UTIs because we know that's my favorite subject. And I have people go, what's a UTI? Oh my gosh, it's a urinary tract infection. So I guess what I'd tell anybody is if you don't know, ask.
The other thing too, a nice solution I try myself when I'm talking to patients and all that is I don't use the acronym. I'll say adult daily living, also known as ADL. You can educate the patient so they know what they're hearing. So you may hear when you're in the hospital, we're going to evaluate you. When you're getting ready to go home, they may come in and say it's going to be a skilled nursing facility. You may hear it as SNF, and if you don't remember what I told you, just make sure that you ask.
And that's the only time I like to use the F word, skilled nursing facility, because if it's anything else, I really try to avoid the word facility and say community. So if you use that with your loved ones, if you use that in your conversation, it's much more empowering. No one wants to live in a facility. A facility is warehouse or prison. So empowering language is important, and ask when you don't know.
Well, and what I like is the minute the crisis hits and you're in the middle of the healthcare system, whatever system that is to stop and say, please give me the acronyms that are in this facility. Tell me now so they can take notes.
We have so much more, and we'll be right back on Aging Untold.